I wake up in the morning, thank the Most High. Husband, 7 kids, thought I stopped at 5. A roller coaster ride. German Shepherd by my side. Love the holidays. Come along for the ride. If you try to copy this and don't give me my props, I'm a train without brakes. Charlotte can't be stopped. It's your mouth you drop. It's the mic I drop. I do it all from an Android. No help, no gigs, no props, no team of yes men, not even a laptop. Let's go. Good morning, y'all. Well, it has been officially a week since my what they call rebirth day. Good morning, boss lady Denise. Good morning, Jared Talks. I just wanted to give my quick update. It's been a week now since my bone marrow transplant, or some people call it a stem cell transplant. My brother was my donor, and yeah, I just wanted to give the updates, all the nitty gritty. I know people are so used to seeing me like bouncing around, dancing around. It's good to be here. It's good to be here. It feels good to see another day, be able to walk over to the window and just look up. But I had some rough days, some very rough days. Thank you. Thank you, boss lady Denise. I went through dry mouth. I went through feeling nauseous. I did lose my appetite for a little bit. And I went through this stage of just feeling like everything had been taken out of me, which it was. It was like, but you could feel it. You could feel that you had absolutely no energy. And oh, I got my spray right here. For the dry mouth, I have to spray this in my mouth like a few times a day. And these 2 mouthwashes that I have to put together, wash it around in my mouth and then spit it out. That helps with mouth sores. I didn't get mouth sores this time, but last time when I had my chemo back in July, I did have mouth sores. So I'm trying to stay hydrated, and I'm trying to keep moving around, but there are some days where you just really can't do it. You try to push yourself to at least do 1 or 2 laps, but that's about it. I want to say the worst of all of this is the sickness, like you feel like you have a flu or something, and it's really the cells fighting each other. So my cells are trying to fight to survive, and it realizes that there are new cells in my body that are trying to take over. So that's the conflict. That's the conflict. So I even went through something called rigors. Rigors is when your body has a temp, a fever, and your body is trying to control it, but at the same time it's really causing you to get the chills, the shakes. I had the shakes really bad. Like I was shaking uncontrollably, and I started getting really cold, but they said my room was warm, so they had to give me some medication to stop the shaking. And they had to give it to me through my catheter line. And when they give it to you, they have to give it to you really slowly, because this goes straight to your heart. So they give it to you really slowly, and you're just sitting there just wanting to all just up already. I'm tired of this. But it's best that they go slow when they're putting the meds in. And when I went through rigors, that was one of the tough times. And after you have the rigors episode where you're shaking really bad and your temp spikes, then your body is tight, because during Rikers you're shaking and shaking and shaking. So after it's after it's done, now your neck hurt, now your muscles ache, because you was kind of stiffening up that whole time you was shaking. um the dry mouth is really just irritating. It's not because I don't have sores, but I have the dry mouth so bad to the point where like this white stuff comes up and you still feel funny trying to eat your food. um when they would give me food that I normally like, it would taste like cardboard. Like it just had no taste at all. And I would hate it because here it is, some food sitting in front of me that looks delicious, smells good, but had no taste to it. So I can't describe that, but that was a side effect. Um, just not feeling like yourself is horrible. I like to get up and shower and put on clothes and put on my earrings, and I like to be able to like read through a couple of scriptures. And when you're going through this, some days you just don't feel like doing any of that. You're gonna have people around you saying, "Oh, just get up, just walk around a little bit, just do this, just do that." It's easier said than done, because you literally have nothing. When I say nothing, the chemo, the radiation, and then the introducing of new cells in your body, it wears on you. Good morning. Yeah, it wears on you. And the fact that you can feel that it's something going on inside of your body that's not natural, that's not normal, that affects you too, because then you're thinking in your head like, is this it? Is this like, is this what my creator has for me? Is this like, why am I going through this? You start, it's a mind thing. You start messing with your mind, and you got to stay mentally strong. You have to like pep yourself up. Like I said, you're gonna have people around you saying like, get up, you gotta move, you gotta do your breath thing, you gotta do this, you gotta do that, and you're sitting there like, can I grasp the idea that my body literally has zero of everything right now? Oh my goodness, I'm already married. Really? Um, Thank you, boss lady. I feel I feel drugged down and like I've just been through something horrible, and I'm just kind of coming back in the house like that's what I feel like. I feel like I just went through something and I'm trying to make it back home. So, as I can see, my channel must be growing because I'm starting to get a lot of trolls. So I'm trying to keep in mind what Wellness with Frugal Mama said. She said trolls come with growth, and I'm holding it in my pocket. Just um, I just wanted to give an update. And if I keep staring off, y'all, it's because I'm literally at the window. That's what I do. Let me see if I can turn the camera around so y'all can see what I see. This is my view. So I sit and I just look out the window and I can see some of the traffic. I'm feeling okay. I'm feeling okay today. I just really wanted to be honest about my days 1 through 7. It got hard, and I don't want people to feel like it's impossible. It is possible to get through. You just have to make sure you stay mentally amped. That's what I'm gonna yeah, Wellness with Frugal Mama, she put that little nugget in my head one day. She said with trolls come with growth. Growth comes with trolls. So yeah, I'm gonna hold that in my pocket. And I told her I was gonna hold that in my pocket too. Um so I just wanted to give an update on the first 7 days. I want to try to be as honest as possible because I know when I was first diagnosed, you did not see many people discussing the details of of the procedure or what they were going through, the ins and outs. So I figured, why not? And I don't want people to get to the point where they feel like, oh well, she's doing this, so I'm gonna do it too. Please, y'all, do not wish somebody else's life or content on yourself because you never know what all goes into it. That's why I'm such a stickler on staying true to myself. Oh, she's in the chat. Hey, Wellness with Frugal Mama. um, y'all be doing like premieres and stuff, and sometimes when I get a notification from y'all, I be thinking y'all doing it right then, like that's your video, and then it'll say upcoming, and it'll have the date and stuff. So, I'm gonna say like 55,000 times. Like Yin Yang Twins say 50 little times. But when I first got diagnosed, I didn't see a lot of people, especially a lot of people that look like me, really discussing in detail, step by step, what was going on. The hospital, they are treating me really good. Actually, the hospital that I'm at, this is what they specialize in. Like, this is their thing. They are known nationwide for dealing with leukemia and for having the success rate, a great success rate with stem cell transplants. Good morning. Well, it may not be morning where you are if you say you're in Iran. So good morning, good afternoon, good evening, whatever you are, wherever you are. Yeah, because you have to be careful with using that C word on YouTube. People will try to sue you or something. I heard that California is a good place too for different types of cancer. They have a good success rate. In Birmingham. I know. Yes, so like I was saying, I just wanted to give my take on it. And y'all, please, 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 because I have noticed this a lot on YouTube. People will see other people's numbers go up because they're talking about a certain topic or something. So then they want to do the same thing, or they try to mimic the same thing. Do things your way. Please stay true to you, because I know me personally, I have seen people that say they only support people who talk about this or who talk about that. Me personally, I like to watch a variety of people doing different things because you can learn something from everybody. And when I put up my content, I try to stay true to who I am, because I know that some people are following my journey for the knowledge. They want to see what step by step what I'm going through. Good morning, Sandra D. Thank you, Ty D. I'm going through leukemia. I have had the bone marrow transplant, so now the thing is my body has to recover from the actual transplant. Oh, that's another thing I need to bring up. They started me on a new medication that prevents you from having, not prevents, let me not use the word, it helps prevent from some symptoms of graft versus host disease. So that is something that can happen. They're going to dry mouth again, y'all. I can't help it. Sorry. That's why I have to use this spray constantly. But it's a medicine that I have to take that helps with some of the symptoms of graft versus host disease. Because when your cells are fighting against the new cells that have been introduced into your body, sometimes your cells will try to overtake the new cells before they have a chance to graft. So with that being said, you have to take some sort of medication that will help prevent, sometimes you may get a rash from it, sometimes you may get sick to the stomach because of it. They say some people have ended up in ICU because of graft versus host disease. Destiny forever walks. Wait for it. Wait for it. I love when you do those. And then there have been some where you be dressed up and on the thing. I'm like, really? And when you jump rope, I love watching people jump rope, of course, because I love to jump rope. So I like watching Destiny Forever Walks. And she has like a series. Y'all need to go check out Destiny Forever Walks. A motivational series where she's putting out some golden nuggets y'all might want to catch. So the whole graft versus host disease thing, I haven't shown any symptoms of it as of now. So I'm only on day 7. My numbers are still really low, but that's what they wanted. Remember, they wanted to drop my numbers very low. And then what's going to happen is once the new cells that have been introduced start to sprout a little bit, then my numbers will start to bump up a little bit. But I have certain immunities in my body where my body does not just accept any platelets. They have to be matched platelets. They have to be platelets that they know are going to stick and my body's going to accept them. So, as y'all can see, I'm hooked up to a lot. Well, I can't really move this thing. I'm hooked up to a lot right now. So I have 1, 2, 3, 4 pumps that I'm hooked to right now. That's because I've been getting platelets through the night. I'm sorry, y'all. So I've been getting platelets through the night. Hello. How are you? Welcome to the chat. I'm not really kicking too many people out the chat today, y'all. So if you're one of my moderators, don't kick anybody out the chat. Don't block them just yet. Let them give me some watch hour times. Allow them to sit and watch and hate from a distance. Because now I am trying to build my channel. At first I wasn't trying to, not build, but at first I wasn't trying to get monetized. But now I feel like it's time for me to get monetized because that would be a nice extra income to bring in while I'm going through this. Because now I have been told that I can't go back to work for at least a year. You're here for my testimony? You know what? And I thought about that on my low days. thank you for bringing that up, because one day I was really, really feeling low, y'all, and I was just like, ugh, this can't be it. This cannot be my life. I'm stuck in a hospital bed. I can't see my babies. It's just a lot mentally. And then I thought about it, like maybe what I'm going through can help somebody else one day. Maybe this is a part of my testimony that I could share. Okay. Have a great day. Have a great day. Thank you. I try to be strong, but I do have my days. We all are going to have our days. We all have our time. I try not to knock anybody for what time period they are in their journey. Everybody has to go through their own journey, and I appreciate you for seeing the light in me or the strength in me, and I hope it's the God that you see in me. You're sick? Oh my God. I'm so sorry to hear that you're sick. I don't like to see anybody sick. It saddens me. But when you're having those days, it make you think of everything, every detail of your life. It makes you wonder, did I do anything wrong? Hillary, you're recovering from transplant in May. That is awesome. That is amazing to hear. That is amazing. Thank you. You say I got this. Thank you. Yes, I do believe that God has me. That's amazing to hear that you are recovering from back in May, because I have started thinking like, am I going to be okay by like next summer? Am I still going to be like having a hard time with this? But the doctors say that I'm doing well and I need to keep walking. Did they tell you you have to keep walking when you was going through your tough days, Hillary? I really want to know. I'm kind of intrigued by the fact that you are recovering from a transplant. So forgive me if I'm asking questions. Yes, I have been told to walk daily. So yesterday I didn't walk at all. I walked around my room because I'm an introvert as well. So when they're out having their okay, when they're out having their little powwows and they're changing shifts and everything, I don't like walking through the hall with my big old machine with my pump. I try, y'all. Y'all gonna have to keep me motivated. Make sure y'all tell me to keep walking, because I would listen if y'all are really telling me out of love. But if you're telling me just to be snobbish, you know how there are some snobbish people that they'll say, "Oh well, you not walking. That's why you didn't do this. That's why," and they feel like they're so much better than you because they do this or they do that. But if y'all tell me, and I know that y'all know my story, and y'all know that I'm not a lazy person, y'all know I like to get up and dance, I would listen to y'all. Okay, and I'm gonna most definitely listen to Hillary because you sound like you know what you're talking about. And Marze, I don't know how to pronounce your name. I hope I'm saying it right. Marze. It's really tough and it's hard to explain. I'm trying to listen to my body too. Just like when I went out there and I did my 3 laps. I wanted to do another lap, but I had to listen to my body because it was just feeling like if I didn't stop and sit down, I probably would have passed out. I started to feel like out of breath and like a little weak in the legs. I'm glad I said your name right. Good morning, J3GS Forms. I love watching J3, y'all. Sometimes I can't comment, but I love watching J3. Sometimes I sneak in when you're doing a live late at night. Sometimes I sneak in and just watch. Sorry, y'all. But that dry mouth part is kind of hard too because it's called dry mouth, but it give you this mucusy stuff in your mouth. Thank you so much for praying for me, J3. I think I got my husband watches you too. He just never shows his he never comments. Y'all, this has to be the roughest part. I hope this is the roughest part. I hope I'm over the hill and like it's starting to calm down. I hope, because when I tell you it's a lot just to get up and do the basic things, to get up and have to have this with me, this pump with me, just to go to the bathroom. We have to brush our teeth like 4 times a day. I have to use this spray pretty much all day. And my little mouthwash things, I have to use these to prevent sores in the mouth. It's a lot. It's a lot when you're not feeling well. Now, if I was in here my old normal self, it wouldn't bother me. It wouldn't faze me. But when you're zapped of all your energy, when you're zapped of all your energy, it's very frustrating because you want to do the right thing. You want to walk when they tell you to walk. You want to take your sprays and your mouthwashes and stuff when they tell you to. You want to brush your teeth 4 or 5 times a day to prevent any germs or septic something in your mouth. I forgot what they call it, so forgive me if I'm not saying it right. But it's better for you. It's good for you. But at the same time, you feel drained. You feel like it's taking so much just for you to get up and just go to the bathroom, let alone go to the bathroom, shower, brush teeth, spray this spray, breathe in your machine. I think I told y'all about this already. I have to do this a few times a day, and yeah. So that's a lot for me. Thank you, Destiny Forever Walks. I keep telling myself, you got this, you got this, you could do this. This is nothing. This is nothing. This is nothing. You got this. But whoa, some days I felt like, oh no, y'all. I would tell my nurse, like, is this how other people feel? But okay, I'm gonna be very honest with y'all right now. Okay, a lot of you guys know that I'm 44 years old. And when I have my rough days, I'm sitting in here thinking like, what about the older people that's going through this? I see older people in the hallways going through this. and it makes me feel like really bad for them. I don't know why, but it's like I just feel like if I'm having a tough time and I'm trying to force myself up and pep myself up, I wonder how they're feeling. And I'm praying and I'm hoping and I'm in here just like, God, please give them strength to go through it. I really feel bad for some of the people that's going through this that already have other ailments. It hurts. I'm just gonna be honest. It hurts to see the elders going through this. There's the cutest couple here, y'all. I don't mean to tell nobody business. Y'all don't know their name. Y'all don't know their face. So whatever. I'm just gonna tell it. It's this older white couple here. They are the cutest. She's so tiny and he's so tall, and both of them have these piercing blue eyes. And you could tell they're smiling even with their mask on, and they are the sweetest couple. And it hurts me to my heart, it's to my core, to see them walk in the halls together because he's walking with her to get her steps in. Thank you, Destiny Forever Walks. Thank you. Yeah, but seeing that older couple, and you can tell that they are older, and they walk really slow, but when they pass by you, they speaking. You could tell they're smiling because you could see their cheeks rising up, and I just feel like, God, just please give her the strength, give him the strength he needs to care for her, because he's such a like loving husband. You okay, honey? You got this, and he's making sure her gown is on good in the back, and they walk slow, and they walk, they do what they can, and I'm so like heartbroken because I'm like, they're such the cutest couple, and he's taking care of her, and he's walking slow too, like, yeah. So who am I to complain, basically? Who am I to complain? I get out there and I walk. I can walk a little faster. I can do things that I know she probably can't do. Like if I can't reach my nurse on my call button, I can go over to my phone and call the nurse or whatever. But I don't like to see the elderly people fighting the same thing I'm fighting, because I know how hard it is for me. And they have these blue eyes that are just like piercing, and it just catches you. Their eyes just catch you. How's my husband doing with all of this? I think it's wearing on him. I think he's starting to see everything that I used to do around the house and everything. And at the same time, he's trying to be strong because he has to still get my 8-year-old off to school. He still has to make sure the twins are taken care of. And then when he comes up here, he always tell me like, you're going to be better, you're going to be better. But I feel like he's having a hard time dealing with the fact that his wife has to fight this. But he's not a man of many words. He has the cowboy mentality. He's a cowboy. So they don't have many words, but they're gonna do what they gotta do. And I try to comfort him, like you was saying, like your wife worries, and you try to be better. It's almost like you try to put on a mask, you try to put on a happy face, like I'm good, like don't worry. Yeah, I can understand that. Your wifey gets mad at you, can't take all the medicine. I think my husband gets a little upset with me when I start talking about if I don't make it. If I start talking about the plans that I would like for them to, um, you know, the things I would like for them to do if I was to transition, I think that's when he gets mad and upset with me. Um, he'll say, well, we're not thinking about that. That's not what's going to happen, or that's not you, or that's not going to happen for a long time. He say things like that. So I can't really talk about my plans that much with certain people. But I would like for people to know what I want. So, he's taking it pretty well. But like I said, he's a man of few words. So, there that goes. But I'm not going to keep y'all long today, y'all. Thank y'all for coming in and sitting and chit-chatting with me. I feel so much better than I did on days 2 through 4. 2 through 4 were pretty bad. Yeah, sometimes you hurt really bad. Thank you, Boss Lady Denise. And sometimes I sit y'all up when I'm listening to y'all. I go through my subscriptions and I just play people's videos. And sometimes I might click the like button, but I don't even comment or anything. Sometimes I get frustrated with the whole comment section anyway. So sometimes I don't comment, but I'm watching y'all. And I prop y'all up on my little dinner tray thing and just watch y'all like that. So watching some of y'all channels and watching what y'all do through the day helps me. So Boss Lady Denise, I do watch you. I watch Wellness with Frugal Mama. I watch J3GS Farms. I watch Jared Talks. Um, I watch Praying Couple Cooking Series. I watch Destiny Forever Walks. Who else do I watch? I shouldn't even get into naming names because I don't want to overlook somebody. But I watch a lot of you guys and y'all get me through. And y'all appreciate it. I appreciate y'all for putting out content that I could just sit and just let play because y'all are talking. I like original content. I like when people are themselves. I can sense when you're not being yourself. Um, I can sense it, and it's kind of make me not want to watch. I used to watch a couple of people, and I stopped watching them because I saw that they weren't really genuine. They was just trying to do anything to get their numbers up, whatever, to get their numbers up and not staying true to themselves. So I appreciate y'all for staying true to yourself. Hmm? Good morning. You brought me something to eat?
Yes, I did. I like your earrings.
Thank you. They say Renee. I'll try to be old school.
I got you. Breakfast down here, okay?
Mm-hmm.
I got you. I'll see you shortly.
Thank you.
Of course.
So they just brought me breakfast. I'm gonna try to eat. That's been my main issue. They want me to at least be able to take in 1,000 calories before they let me go home, and also they want my platelets to be at a certain level before I go home. It was another one. Oh, the third and final thing is they want me to go at least 24 hours without spiking a fever before I go home. This morning I didn't have a fever. That's good because this was the first morning in the past 3 days that I did not spike a fever and have the rigors. I hope I'm saying it right. If y'all look it up, y'all will see. But I had rigors so much every time I would spike a fever. Well, they don't want me to floss right now because flossing can cause some bleeding and my platelets are low. So I do have to brush my teeth like 4 or 5 times a day, and I have to use the special mouthwash that they give me. But they don't want me to floss because of bleeding. Yes, my platelets are too low. They don't want me to be rough with that.
Hello.
Hello.
Oh, wow, look at that.
Get off my live, okay?
Oh, sorry. You know, you can continue. I'll come back.
No,
You know,
that's okay.
I'll come back. Listen, you didn't have any fevers now.
I was just telling them on live I didn't even have the rigors.
The rigors, yeah. You want to go home?
Yes, I want to go home.
I will tell Dr. I will ask him, Dr. Solomon. The only reason you're still here because of your platelets.
Because of the platelets is a problem.
You got how many units last night?
I believe it was 2.
2? Okay, and it bumped up to 12. And Wilm's gonna give you more.
That's
so I will ask him. Okay. All right.
Okay, thank you.
Is he up here already? Okay, I'll be there. Thank you.
So I might be able to go home. That would give me an appetite. I'm pretty sure it would, but unfortunately I don't. Ooh, I don't want to give y'all the show. But I think I need to do another video talking about the things that I bring to the hospital with me, because this is one of the things that's good. If y'all know anybody that's going through, you heard him when he said he's gonna try to get me to go home. Even when I told him I was on live, he was like, that's okay. So one of the things that's good to give somebody who's in and out the hospital, a pajama set with the buttons, so that way even if they have a line or anything, it's just easier. I tried to get the chemo shirt. They have this thing called a chemo shirt. Too much money. It was like $40 for one shirt because they had the zippers all down. Y'all, if y'all know somebody that's going through chemo and they're going to be in and out the hospital, get them a pajama set that have the buttons. It could be a El Cheapo pajama set. This one is a El Cheapo pajama set. It's a little thin, which is good because I do get hot. I get fevers at night. The lines can still go through, still accessible, and they still look cute. But anyway, I'm going to let y'all go, y'all, because I'm going to call my mama and tell her I might be going home today. And I'm going to get over here and see if I can eat some breakfast. So until next time, gracias por ver. Thank you, Wellness with Frugal Mama. Thank you, Boss Lady Denise. Thank you, Marze. I hope I'm saying it right. Thank you to everybody that came into the live to join me. I love y'all so much. I love watching y'all. Destiny Forever Walks. I love you to pieces. And hopefully I'll be back to my normal self soon. My hair is coming back, let your soul glow. But I'm gonna call my mama, y'all, because I'm excited. I'm breaking out. Until next time. Yes, it's French. I love French. Let me see if I can speak a little bit. Bonjour. Bonjour, monsieur. Je comprends apprend le français. But anyway, until next time, thanks for watching. Gracias por ver. Adios. Bye.